Okay, so I'd like to start. There's a lot. This is my most favorite topic to discuss the cyber public health, the CPH. How are we going to move forward from here? We've got some challenges with the new administration we had, but we believe in this model. And then Josiah put a very good paper with Adam Shostak and others to the quad paper for the CRA. Josiah is going to speak about this paper and his views on that cybersecurity lessons from the American public health system. Quickly, you all know about Josiah. He is currently a director of strategic initiatives at the Trail of Bits. But he is deeply involving to academics and then also a technical and innovation brain at the NSA for a long time as a technical director. So thank you very much, Josiah. And he's been a great help and vision and thought leader on establishing this cyber public health. So with that, Josiah, we're very excited to hear.
Thanks, Yuri. Great to be back with everybody again. This is a friendly, familiar crowd. I'm glad to be back. This is also a topic that I think we've talked about to some degree, but it's number three, a practice, because I'm going to give this talk again to the Purdue Syria Symposium, and I would love your feedback to help it. The paper's already out, so we can't make edits to this paper this time, but there's always more opportunities to refine the ideas and to spread them. So what's nice is that this is yet another resource we can share with people. Please do interrupt me as we go along. Love for your thoughts, comments, tell us where we're wrong. As you can see, like I am one of six authors on the paper, including Adam, who invited me to provide some comments. I will start where we always do, which is with the same story that we know to be one success from public health. The cholera outbreak is an easy to grasp onto example of something that worked in public health and feels intuitively in my gut like the kind of thing I would like to see in cybersecurity. Not only that outcomes are important, outcomes are probably the thing I am the most interested in studying, but the infrastructure around it. What are the people, the organizations, what are the research projects that you and I can do, that we can advocate for, that hopefully we can get more help with. And the bottom line for the paper that we put out was that the US specifically needs a new approach, new national institutions for data collection, measurement, coordinated response to achieve things like John Snow did with cholera. So that is the sort of bottom line up front. That's the basis for, I think, what this group has been talking about for a long time, what CyberGreen is advocating for, what many people on the call here, I think, resonate with. For those of you who have never heard of CRA, it is not an organization I have always been associated with. I'm not a member of this organization, but it might be one you want to consider. They are another not-for-profit organization. They bring together not only academics and researchers, but practitioners, that's me, other professional societies like ACM and IEEE. And one of the activities that they do are every 4 years, they put out a call for papers. They want groups, people's organizations to write papers that matter for national attention. They're specifically looking not for sort of small, narrow problems and solutions, but what are the big ones? What are the things policymakers should be looking at? Where is there not funding but needs to be? And this year, they have at least so far released 9 papers, including the one that we're going to talk about. And as you can see, they cover quite a spectrum. It's everything from PhD students to hardware to quantum computing and public health. These are big topics. The papers are not that long. They tend to be 4 to 6 pages. I'll find the link and put the one that we released as well. But I'm glad to see cyber public health among this conversation. So for all the people that pay attention to CRA, all the policymakers on the Hill, we are now part of that conversation. The thing that I'm going to end with today is, who else should CRA send this paper to? They gave us an invitation as authors, to say, we will send this to Hill staffers. We will send it to state representatives, whoever needs to see this to help with the conversation. I would like your input, or you can reach out to CRA and say, you should send this paper to my senator. They want to do that. They want to be part of that conversation. So where we start in the paper is where this group sort of often starts, which is, what is this intersection between public health and cybersecurity? Not unsurprisingly, we focus on population level problems, not necessarily my laptop or my phone, but the collection of them in some geographic location. All of them in America, all of them in Maryland, all of the ones among computer scientists. Whatever that population might be, that's where public health focuses, not on individuals, but on populations. Similarly, not enough focus and attention on that in cybersecurity. Next is the sort of focus on outcomes. In public health, it's a little bit easy, as we know, to look at life, longevity, mortality, those kind of measurements. We talked at the workshop, a year and a month ago, about what to measure, how to measure, and the lack of those measurements in cybersecurity. I'm pleased that Google and others have sort of volunteered and raised their hand to say, we don't need to know definitively what those are. We're just going to try stuff. We're going to start measuring things and see what works and what doesn't work. Public health has the benefit of 150 years of trying that. We don't need to wait. We can try those things now. And what our call in the paper was particularly for national leaders and policymakers, those with influence and authority, including in companies, to say, we need to mimic the things that are working in public health, because there's every reason to believe that it will be successful to make cybersecurity better as well. We focus on 3 things in the paper that are measured in public health that we think can be analogous to data that could be collected and used in cybersecurity. One is the measurement of populations. This was in the CyberGreen paper from the workshop as well. What are those sort of atomic units of measurement? Is it accounts, people, devices, uptime, whatever it might be? This does work. It worked for Jon Snow in measuring who got sick. It certainly could work in populations of devices and people online. Outcomes is the one where my sort of passion is. This is always, we learned it in grad school. We learned how to measure what works and doesn't work in very narrow situations, but figuring it out on a systemic level is so frustrating. The fact that not knowing if an outcome, even if things like antivirus are working or not working, making the world better or not better, that disconnect frustrates me nearly every day. And yet public health somehow has learned, decided, evolved to get their arms around some kinds of outcomes that are meaningful. Human life is one. Let me actually jump ahead 2 slides to daily adjusted life years. This is one I think is kind of interesting, and I haven't quite figured out what it means in cyber. The years that I live with type 1 diabetes are different than the years when I did not have that chronic disease. What does that mean in terms of the time that my account is infected or the time that I have ransomware? I'm not sure that's quite the right analogy, but I like this line of thinking. What does it mean to not basically have the ultimate solution you want, whether that's human health or the privacy that you expect or the security that you expect? So outcomes is one, and vectors is another. How do people get infected? How did diseases spread? And very clearly, Jon Snow used his medical knowledge plus this other data, right? Spatial data, statistical data, saw the opportunity to measure like where were infections happening, where was the where did the spread seem to be, even though that feels unsatisfying, like as a computer scientist to say, well, because one computer is infected, anybody on the internet can get infected. I don't think that's an easy out. I don't think we should stop and just say, well, the internet is hyper connected, so spatial data doesn't matter. Disagree. Like this is worth measuring to see where does geography truly matter in what seems like a non-border kind of problem. We point out in the paper that this isn't necessarily just an easy metrics question because of all the interconnected systems. But to my earlier point, I think it's worth an investigation, research and otherwise, to say, well, where do simple metrics help and where do sort of complex metrics, where are those required? Blake, go ahead.
Yeah, so I truly appreciate that. Turns out I read the wrong paper in preparation for this, which is fine. I'll just catch up later. I think what's really interesting that you're kind of getting at is, and this shows through some of the public health concepts, is this populations of convenience. So case definitions are defined populations in a point of time in a geography. What that means for cybersecurity is up for debate, right? But we can define the population as a population of convenience. So an outbreak, for instance, to take a real example, this outbreak of measles in Texas is defined as a population of convenience. At that moment, we have defined the population during the outbreak. And then we say, what is the attack rate, which is an epidemiological term of how often do those individuals infect others, and what is their case definition, which defines the point in time and the symptoms that they experience that is together measles. It's easy for measles, right? Because we have the tests for it. So we can easily say, okay, we're going to test you. Yes, you have measles. Congratulations. But before that, when you're talking about this water example, he had to create a case definition and a population at the moment that he was studying the population. So that's something of particular nature that I think you argue in your other paper a little bit, where it's this defining the population at that moment. So in the CyberGreen workshop, we were having difficulty with the population. I would argue we don't need to predefine the population. We can define that at the moment in which we identify a problem. So we can define our population conveniently at that moment. And so that's my only note about this.
I think that's
Great work.
I'm going to add that to my conversation. I think the two things that also come to mind in thinking about that is the sort of industry measurements are typically around sectors, right? So they look at like what is the infection rate in healthcare versus the energy sector or retail or something. But that's, I think, not what you're saying, which is we don't need to define, like that isn't necessarily the best or only way to do that. It is a convenient way, but not necessarily the best.
I think you're getting at a really important point that this is interesting because coming from the outside, sectors of society is a CISA thing. Other government agencies do not define sectors of society in that way. FEMA doesn't do it that way. They define it with an emergency support functions methodology or a core capability way. So like sectors of society is a CISA thing and seems to be heavily cyber inspired. So coming from the outside, from my public health background and my emergency management background, we didn't define sectors of society. We don't even use that construct. We use the construct called community lifelines, which is the new hotness in emergency management, which is sectors of society, but they're grouped into 7 central sectors. And so like it's of note, I think you're getting at a really strong point that cyber defines communities and populations within sectors. That's not the only way to define the population.
The last thing I'll note is, I think, consistent with what you're saying, is that we can look at emergent groups as well. I helped a grad student one time with trying to predict like who was going to get infected on campus tomorrow based on who got infected yesterday. They had a lot of data about that. We didn't know a priori if they were all men or 20 somethings or rich or whatever it might be, but we were trying to tease that out. But yeah, we don't have to necessarily know in advance. I 100% agree. Okay, we talked about daily adjusted life years. Again, I think this gets to outcomes. Like if the outcome in healthcare is life, that's easy. But if the outcome in cyber is being patched or something, what is the amount? What is the consequence of end of life software? If I run Windows 7 for too long, is that the same as having a disease? Does it sort of shorten my device's lifetime or something? I don't know what that might mean. We have talked, I think, a little bit about things we don't know in cyber. I continue to use this list. From time to time. Adam put a version of it in this CRA paper as well, because I think it surprises policymakers. It surprises non-cyber people that we don't have a better grasp. I do some work with private practice healthcare, and they're always surprised about the things we don't know in cyber too. Like, what do you mean you don't know my likelihood of getting ransomware? I say, well, it's greater than 0%. It's less than 100. Sorry, I can't tell you anything better. But people on the outside, I think often, Blake, maybe you can corroborate this or disagree, that we're not nearly as mature as some people think we might be at this point. Oops. Okay, so I like phrasing questions in terms of like, imagine the future is better. What does it look like? What does that better future look like? And so we put a version of this in the paper, which is, let's imagine that we do have funding and we do have success. What will that look like in that hypothetical future? Decline in successful attacks, that might be one. The publication of things like weekly reports that report on statistics that we maybe care about, outcome measures in health, it's things like morbidity and mortality, this sort of cyber equivalence of that. I would like to see less waste. Devices last longer because they're more protected, and we can prove that they're still useful and don't need to be replaced quite as often. That could be a version that things are working in. Standards that are effective and applicable. We have some of these in cyber, thankfully. There's a lot of computing standards that appear to achieve some level of success. But this is always an area that is kind of still debated. So I think we can start to paint a picture of what do we want success to look like, and then kind of back up the question about, okay, if that's what we want, how do we get there? We make a pretty strong case, and this is an interesting time in history to make it, that the federal government should at least, or perhaps could play a role in making that future vision a reality. One, they can look at a bigger picture in a way that a single company, a single individual, a single entity probably cannot do on their own. More access, more care abouts, sometimes more resources. They can coordinate sometimes more effectively, especially between public and private sector, in a way that just is a little bit more difficult for CRA to do, or ACM, or any sort of other ISAC, for example. The government just has the reach and purview that others don't. It used to be they had more money. That isn't necessarily true at this precise instant in time. And the bottom line that I'm going to get to in a second is, what can we do in sort of this absence of federal leadership? But in theory, it would be great, it would be helpful if there were institutions, if there were research money, other coordination that could happen at the federal level. And we've thought a little bit about what that looks like in specifically, like having offices of statistics, for example. But there's certainly no guarantee. There has never been a guarantee. And right now it feels especially uncertain. I would love to think about that uncertainty a little bit. What does it mean if that doesn't exist? How can this group step up? How can we get the right momentum, even in that kind of absence? So we make a handful of sort of specific recommendations. One we've talked about before is this Bureau of Statistics, not only to have it, but to give it some home, the way that the CDC is a home for collecting statistics, and some charge to collect them. It's easy, I think, to just sort of hand wave and say, all right, we're going to have this institution, but unless it produces what it needs to, that's sort of a hollow promise. Again, what does it mean if the government doesn't, won't, can't do that? Can it be stood up somewhere else? How could we make it effective if this group did it? How could we make it effective if CRA did it? I'm more and more eager to make progress, even in the absence of having the government sign up to do it. The next is about measuring outcomes. There's some of this already in place. So like FISMA tries to do this a little bit, except for the cyber stats, there's not an office or a department. Like FISMA has a home, it has a statute, it has teeth to some degree. But we need that measurement, root cause analysis, sort of understanding lessons learned, especially when like the CISA, the cyber board is not active at the moment. That feels like a real shame to me, sort of personally. But I think that would help reduce the sort of cost of the cost of insecurity if it had a home, if it had some teeth to back it up. So a couple of things on sort of whole of government. If we push this boundary a little bit, what does that look like? There's almost always a national cybersecurity strategy. It sometimes takes some time to get out. New administrations put their own viewpoints on it, which is fine. We call for cyber public health to be part of that strategy. The strategy doesn't necessarily lead to action, except others nest their strategies underneath it. The Defense Department builds a strategy based on the national cybersecurity strategy. Companies make decisions and say this points to supporting the national cybersecurity strategy. So it's more than hollow, and it's probably the right place to push the button a little bit. Number two is that we, the authors, would love to see a task force for coordination. That doesn't exist today, and as a result, communication and information sharing is more ad hoc than it needs to be, despite point solutions, including the ISACs and other sort of information sharing communities. There isn't one devoted specifically enough to cyber public health to make it effective. Number three would be sort of this group on steroids, perhaps, which is a national framework for cyber public health. That would, again, give it some credibility, national visibility, and get a group of people in and outside of the government to align and work towards a common standard. I think we here have given this some framing and direction. Building it at the national level, I think, would be even more powerful. So those are whole of government efforts. If we look for a second on institutions and data, which may or may not be national, one idea is a Cybersecurity Public Health Institute. Again, to give it a home, this might be a way to have people and money and perhaps even authorities in the way that public health does. I think Adam and I have talked before here about like the disconnect in the public health community and the healthcare ecosystem makes even public health less than optimal here. That maybe is an opportunity to do it right or better in cyber, but there isn't even this institution today. I think I have 5 of these. So number 2 would be something like a national repository. This is a proposal to make a perhaps centralized database, data store to collect information across sectors, even if sectors aren't precisely the right thing, but across boundaries, let's just say. It might be more narrow in scope than an institute. These aren't necessarily mutually exclusive, but having that data available would be useful for researchers. It would be useful for helping us sort of push the boundaries on what's possible. Number 3 is the idea to implement sort of reporting standards. Whether or not this is mandatory, at least where we want to start is let's develop some standards. What does this look like? There are similar disease reporting requirements in public health. If you have a hospital that has an infectious disease, there are compliance standards that say you have to report that. There is nothing in cyber, and maybe there should be. We're not ready to sort of say what those might be, but we need to start on it, start doing it. Perhaps they're mandatory. Perhaps they're mandatory for certain people and not others. Maybe defense industrial base has mandatory reporting to the DoD. Maybe the financial sector. Again, I'm sorry that my head goes to sectors, but CISA has sort of pounded it into me. Okay, number 4 is some long-term learning. I think there's at least a nod to this. There has been in the Solarium report. I think the CISA board was a step in that right direction. But there's so much focus on sort of immediate threats in cyber. It's so tactical in terms of what is the threat today? We must stop this spreading intrusion, and not enough long-term thinking. What can we learn from prior events? What can we learn from the response to CrowdStrike or any other sort of large-scale outage that makes them less likely in the future? That unfortunately just doesn't exist. A couple of notes about research. I work for a company that does research. I'm a researcher at heart. I love for these. Yeah, let me pause a second. Blake?
I really apologize. If you wouldn't mind stepping back slightly. I do really appreciate these 4 ideas. I think that they are, one, you're doing God's work with like defining what the space is. So like, don't please take my if it sounds as a criticism, it is not. So some of the things that when I look into this cybersecurity space, one, democratic planning is possible. And arguably, we do that at a national level with disaster response. It is assumed that the disaster response will be led by the local agency, and the federal and state governments will support local decisions. And so that kind of democratic planning does happen. There is some coordination at a national level. I completely agree, but it is not necessary. 2, I think that the space for cyber public health is still young. I don't even feel that we confidently have a clear definition of what the space is that could easily transcribe into an agency. Partly because, and the reason is there is a heavy focus on data right now inside of this space. That's fine. But public health is more than just the data. For instance, the World Health Organization releases 12 essential functions of public health. Only one of them is really focused on data. The rest are public health protection, or health protection, health promotion, detection, which is kind of data centric. But there's also like public health stewardship, public health workforce, which gets into my next one, which is I feel like, especially on your incident notification, there is no clear standard for what an emergency responder in cybersecurity looks like. There is no functional organizational structure that these teams are using. When I ask this question, people think I grew a second head. I say, what organizational structure are you using to respond to this emergency? And they go, we have a P1 team. And I go, there is an incident management system. Do you use it? And they're like, what are you talking about? So I feel like that there is a huge amount of space in cyber public health to define what does the responder look like, and what is that training, and what is those core capabilities of those individuals, and what is that standard. Also, like behavioral standards, like you can't work 20 hours straight. Please God, don't. That's terrible for your health and sleep schedules. Um, so I feel like cyber public health is the space to build more than just single data institutions. For example, I feel like MITRE is and NIST is a tactical cyber public health agency. They define
Blake,
standards.
Blake, Blake,
Oh,
can
yeah, go ahead.
I didn't attend this Zoom to hear you. I heard. Can you allow him to
I'm
speak?
sorry. I'm
Okay.
sorry. I will
Well,
stop.
it's okay to ask a question, but if you want to have your own talk, you can have it separately. Josiah, please.
Oh, I apologize.
My time's valuable. I want to hear. I want to hear the speaker. Thank you.
No problem. I'm also going to take a note about Bill's question about states, because I think that's a good one to come back to, in part because I raised it. Thanks, Blake. Let's see. One comment though. I think for me, the sort of institutions are kind of a necessary evil. I wish we didn't need them, but I don't know that the community on its own will come up with what does training look like for the workforce. How do we get more people? How do we know that we have the right people? How will the coordination happen? Except for an institution, but I'm fine if that's lightweight. I don't necessarily know that it has to be a federal agency. It just feels like it could work that way, but again, sort of perhaps a necessary evil. Okay, let me go into research here for a second. A couple of areas where at a high level would be lovely to have and sort of help our cause. One would be federal funding for this kind of research. Right now, I think all of us in this room would love to get some funding to do more research and don't know where to go. It doesn't sort of neatly fall in NSF. Maybe it falls at ARPA-H if they were to sort of decide to push it. It's not quite a DARPA thing. It's not quite a HHS thing, but it without some centralization, I think it will fall through the cracks. The healthcare folks will probably say this isn't us, and the cyber people will say this isn't us. I've seen this when I've tried to publish papers like this before. Thanks, Bill, for having things like HealthSec, which I think helped to fill in that gap a little bit. But having federal funding would would help push the boundaries forward and get to those outcomes I was talking about a little bit earlier. Adam and I have talked in our catastrophic outages paper, which we presented here before, about testing plans. It's not good enough just to have plans. We have to do exercises to make sure that they work. Public health does this to some degree, and actually cyber does it to some degree. We're pretty mature in having tabletop exercises for outages on a company scale, but not necessarily on a national scale. Adam and I wrote a response, I don't know that we've talked about it in this forum before, to the National Cyber Incident Response Plan. In January, we submitted some comments. I'll post the link to that here. And included this recommendation, which is, sure, you need plans, and it's equally important to make sure that they are effective and accurate when we go to do them. Just sitting on a shelf isn't good enough. That link I happen to have. Community and collaboration. We the authors think having some amount of incentives is important. And this isn't just because Josiah always harps on the usefulness of economics and cybersecurity, but probably that individuals, organizations won't do it unless they're incentivized. That doesn't have to mean money necessarily, or tax breaks or grants, although those are the sort of easy economic levers to talk about, but some kind of incentive, whether that's incentive against liability, or you won't be punished if you help out in an emergency. The development of incentives is where we're sort of calling for there. And while we've phrased this as sort of a US-centric view, I don't believe that is sufficient. I think the international sort of realm of healthcare applies equally to the spread of cyber outages on the internet. The United States doesn't have a way to disconnect ourselves from the internet and isolate ourselves. That's not going to happen. Other countries have made other choices, but the spread of problems, I think, is sort of inevitably international. So having those partnerships, again, is easier probably for a national leader or national leadership to sort of own, but it doesn't have to be the only thing. Big companies, I think, have international partners in a way that make them highly effective, but there needs to be some intentional sort of international collaboration as well. That doesn't really exist today. It would be great to have the kind of workshop that we did with all of us at CyberGreen on a sort of international scale at some point in the future. Okay, so two sort of main takeaways, and these are, again, where we often come back to in this group. One, we're not where we need to be. We continue to be that way. I'm not sure, we've done a lot of talking in the last year. I've been involved in this organization for, I don't know, 12 or 18 months. Loved it. I think we're refining the ideas, and I think that is progress. I would love to see much more. Government is going to be slow, and I'll sort of come back to my questions here in a second on the next slide, but what can we do sort of now? I'm not that interested in waiting. Next is the tie to outcomes. How does it improve long-term outcomes? What are the measurements of that? What can we try now? What data can we collect, analyze, do, and just find out, does it work or not? And so there remains work to do. I am happy to, my brain tends to think on big pictures, but I know that progress is made on the small scale too. Who else needs to see this? Who else needs to hear about it? Who's not in this room that maybe won't be able to come to a webinar, but would read a 4-page paper? We can summarize it for them. We can give them a short briefing if they would listen. In the interim, what can we do individually in our academic institutions or otherwise to think about incentives? How do we count? What do we try to count? How do we measure whether some proposed metric or measurement might work or not? And then how do we self-organize? Let's continue to try the federal route because I think there's value to it, but not stop there. As Bill, I think, suggested in the chat, there's a huge push now to do things at the state and local level. I haven't given that enough thought. I don't even know what that looks like. I don't know what my state of Maryland is interested in doing, can do, would do, and how that would be better or worse than a sort of federal standard. I know different states have done different things. New York City has a New York City Cyber Command, and they do things in the city, in the state, that we don't do here in Maryland. I'm sure California is a similar way. I just don't know as much about that. But bringing that to the surface, finding out what are the states doing now, and the collection of people amongst those states, even if they're doing things on an individual level, to have the state emergency responders get together, the state Homeland Security sort of officials get together. Hopefully they're meeting now. I don't know. I'm not in that community at the moment, but I would love to help bring them together and sort of help that conversation. So that's where I'm going to stop, and glad to take the conversation in direction anybody wants to go.
Thank you, Josiah. It made me think about the state and local, approach a lot. We haven't really discussed the outreach to that layer. We always thought about the federal and national level policymakers. How can we bring a better policy effectiveness with the data? But you're right, given that absence of that role, at least currently, might be in a really critical moment to think about reaching out to that state local. Anybody wants to jump into this or discussion questions that Josiah
This is a,
posed?
Yuri, I have two quick questions. I want to dovetail off your first comment is that if we're dealing with cybersecurity, and let's say I'm particularly with healthcare, there's different sectors, of course, but I'm just thinking healthcare. The physical, um, there's a physical layer and there's a virtual layer. And you were talking about local, state, regional, federal. That doesn't really there's another domain. It's like another way of looking at it in the virtual sense because these hospitals, they're in systems are not there's the same data. You could look at it from different directions, the virtual layer and the physical layer. For Prospect Medical, when they went down, based in California, knocked out Rhode Island and Connecticut, and there's all sorts of things like that. Of course, there's physical in the healthcare domain. There's physical interactions. If one hospital goes down, there's a surge at the surrounding hospitals that cover for that one hospital. But so that's a very interesting space. I'm working with people on network science, small worlds effects to look at that the multi-layer approach. But here's the one question I have is related to real-time data. So there's a lot of CERT interaction with intelligence people in different sectors, and that's I thought that's one way to leverage. And particularly, we get a lot of real-time monitoring, and we know when things are vulnerable. We can almost detect where there's bad public health. So I don't know. I joined late. Did you have anything related to like real-time monitoring in your planning and scheming? That's my question.
Yeah, let me back up here. Let's see. There is a lot. I just wonder if it's the right effective sharing, which is, I don't know if you get a feed that's sort of specific to healthcare or specific to government. And I'd be curious to know, like, does it matter? Like, imagine it got turned off. Are you going to be worse tomorrow because you didn't have it?
Yes. Yes. We like at the federal level, let's just say the largest healthcare system in the world is the VA system. So we work with them. We work with the Defense Health Agency, which is active duty military. And then we work with affiliated associations like FDA, CDC, NIH. And for one example, it's a year ago was Change Healthcare. FDA did not know that they were in the cyberspace realm. It was not. So now they're, that was a wake up call that they are in cyberspace in a big way. So so it's hard not to right now. We looked at the federal assets, and now we look all across healthcare, all the hospitals in the United States. But like in addition, like we're interested in banks and everything because it's you can't isolate one sector from the other in that sense. But there's a lot of interesting work I know about like with intelligence about like how to be smart about these things. It's in the weeds for this discussion. But I think the real time monitoring, all your points you have are really right on. The problem is in the weeds of trying to implement it. It's very difficult. Of course, anything dealing with the federal government now, they're making decisions that are waste, fraud, and abuse that are destroying. Let's just say, look at the NIH. The best healthcare research in the world is being. So this is along the same lines. So, and by the way, I just had a good time with Adam in Cambridge with Ross Anderson. So we talked. We had a chance to talk. So I thought what I saw for your talk was very good, Josiah. Thank you for your contribution here.
I did put the email address in the chat. If people know, if there are organizations or people who you think should have a sort of personal outreach, send them to Catherine Gill. She's been our POC on this paper. She's the one who offered to say, tell me who you want us to send it to, and we will reach out to them. I think we all can do this personally too, send the link. But if you want it to come from CRA, she's a good one to help out. I'll have to look up if I know anybody at MSISAC. I used to when I was in government, but now I think I've lost them. Christy.
Hi, I'm actually a student in a master's program for cybersecurity, and a lot of us are really just starting into our careers. And I'm wondering, I'm going to be talking about this talk in my class because I think that we need to go to more of these things. If there was a message you could have me bring back to my classmates, what would you want me to tell them?
I'll take some help on this. I think it depends on the audience a little bit. I mean, these are people studying like engineering and computer science. Is that kind of who the class is?
We're actually through the School of Business at my school, and we're going on a leadership track. So I think that this is even more relevant since we are going to be going into CISO type leadership positions.
Even better. That's a group I sorely wish I had better connections in.
If you'd like to come talk to us, I can get you connected with our program director after this.
Yes. that would be fabulous. Yeah, what would I make the one bottom line? I think I don't know. Yuri, what's the like bumper sticker for CyberGreen?
Sorry, I was writing a little bit about my, organizing my thought about real-time data and the population data a little bit. So what was that, the bumper sticker for CyberGreen?
Yeah, if there was one message we should give to students of business, future business leaders, how could we boil this down for them, for that audience?
Well, cybersecurity is no longer just protecting your organization and your cybersecurity. It's about making the population level, the internet-wide society level cyberspace healthier. That's what I take applying public health approach. That mindset, like cybersecurity, again, it's not about protecting you, it's protecting the society and then making the internet as a whole healthier. And how can we do that is the questions that we pose to young professionals and also very high level policymakers.
I get to put something forth in our group. Of course, you assume you do everything that's best practices, right? So at the top end, we had to summarize it: measurements and lessons learned. Two things that I think this put us a cut above because it's you can say a lot, but you have to be data, have data support it, and then make a story. The story is the lessons learned. So I think Josiah, you definitely point out that like we're not having lessons learned. I think I have the definitive stuff about Change Healthcare, by the way. I work with the FDA on that, so I can share that with you. And the measurement is the part that we're working with a company that's working with security metrics and security ratings. So I think that's that's the one direction. So that I think we complement each other.
I really like the idea of definitely including the outcome metrics into our the risk landscape or what we're trying to measure the effectiveness of something, policy or mitigation or intervention. Currently, what we are trying to measuring is how much that mitigation practices out there, but we're still not having that implemented. How is the outcome looks like? And then that's we need to connect that loop to really measure, oh, it's working, or this seems not working. There is an incident reporting mandate for critical infrastructure. I'm sorry, Blake, we still using this CISA term, but the CISA was trying to make that mandate instant reporting. for the critical sectors. Can we connect somehow? I am interested in the insurance companies' data. How can we collect or use or collaborate with that? Can we cross-correlate with, compare with the claim data? Um, that's something I would like to, sort of bringing into our metrics framework that is currently big missing.
I think there would be direct analogies that Blake was talking earlier between what they do for public health. They measure disease propagation, the measurement part, and then when I say lessons learned, that would be like the research part. How is it have scientists study how the disease is propagated? Is it should you need to wipe down your groceries when you buy them, or is it propagated by air? So they found that COVID-19 was airborne. You didn't have to wipe down your groceries or whatever. So measurement and lessons learned. So
Yeah.
I'll pass it over to Blake. He has his hand up.
So, and I've been thinking about this as I try and work through this idea is public health has more correlation than causation studies. And so I'm almost curious, independent of the possibility of required reporting, independent of the requirements for, or like this data analytics organization, is there a way that we could do a meta study of the current information put out by these private organizations to build understanding? Like, when I think of an epidemic, like the COVID-19 is a classic example. We all saw that curve. We're currently seeing that continuous uphill curve of ransomware in some of these reports that are already being produced. So we're seeing an epidemiological curve. It is private in nature. So could we build that correlation of all of these different meta studies, knowing that it's private information? Maybe that's the best we can do right now until we can make an argument that perhaps this should be more public. And so correlating all of those private reports on cybersecurity and saying all of these cybersecurity reports are suggesting this, so therefore we can suggest that this might be happening. Not causation, just correlation.
You remind me, I have 7 books on my desk that I'm reading right now, one of which is relevant, which is a book called Random Acts of Medicine. Bapu Jena, who does a podcast. I mean, this book is about like data, medical data, right? And so he does tons and tons of correlation and causation studies, particularly with like government provided data. What does Medicare data say about mortality rates before and after a marathon, before and after, like all these things? He couldn't do any of that research or write this book without that government data. It just doesn't exist. But it turns out to be really interesting and useful, at least to me, and really helpful. Like he does pull the thread sometimes all the way to correlation. Like, does the fact that you're 79 or 80 lead to like left digit bias? That's what I was reading this morning. Like, do you get a heart scan more often when your age begins with an 8 than a 7, even though you might be 1 day apart? So I don't know. It's motivation for me that like the data are really helpful.
Let me back up. Blake, let me just
Go
kind
ahead,
of say, so government information. So right now, okay, let's just take the economics, right? We have a Bureau of Labor Statistics, and they track economic indicators, and right now there's an effort to monkey with that data they've been using for decades. The data, you need to have professionals with statistics that more you get the data. We actually have on the other end of the spectrum is cybersecurity data. I have seen so much. A lot of it's self-serving from the industry providers that they sell cybersecurity products. But here in the Department of Health, and I'll just give you one example that I know intimately. The Health and Human Services tracks HIPAA violations for healthcare. And basically what they report is what's recorded in a court proceeding. So in the United States, if you teach students, you say that they're supposed to get truth out in court, right? What actually is happening is in a court, it's what the plaintiff and the defendant agree upon. So that's what it's reported. And And I'm telling you, it has there's no relationship to what actually factually happened in the ransomware attack or the breach. It's just what the two parties agreed to. It's almost like fiction. So what's happened? Okay, they report these, they have breaches and ransomware and all sorts of malware detections all mixed in this HHS Office of Civil Rights database. Well, there has been PhDs granted by people studying this database, which is totally, I'll just say, Josiah mentioned Dykstra. I had to refuse a half a dozen, some of them tenured faculty did reports on this database. I said, listen, you did a great analysis on a piece of crap. This data, you can't get garbage out. I mean, you're going to get garbage out because there's garbage in. And they were like, I hate to do it, but I was nice about it. And I said, gave them other opportunities. So if the data we have, you look on the internet, basically I gave a talk and the second slide I use is the same slide I think we just passed around. We showed the level, the frequency of internet events going up exponentially. It's almost like everybody uses the same chart. I'm so just maybe came late. You probably use the same chart. It's so that data is missing, and I don't think the meta study is going to work because you got crap all over the place. I mean, you have some of the places like Verizon, maybe if Mandiant tracking it, but it's all looking at pieces of the elephant, right? The blind people. Some people feel the legs and it's a trunk. Some people feel the snout and the elephant's like a snake. So what we need is government data, and I would say like not comprehensive, but like micro and build up. So I don't know if you guys agree with me, but I'm just telling from healthcare, like I know people have gotten their PhDs studying data that's pure crap, So, and I feel bad. I had to interface with some of them,
Yeah.
but
So we've been working on, hey, we need a robust data. We need a data platform, maybe. And then, we need a Bureau of Cyber Statistics. There's a lot of conversation. We see the problem, see the same problem as we, I think, all see. Now is the time, next couple of years, we need to think about a lack of the government support or national level support. How can the community start the initiative of developing that sort of similar function? And then that's something that we need to continue discussing. Not the easy question to answer immediately on this, of course, on this session. But let's continue, please, discuss and put some thought. And this is a group of community who wants to work on that. So let's continue having this conversation. It was a great conversation, great presentation. Josiah, thank you very much. Thank you all for coming and contribute, share your thoughts.